You know, sometimes the moment that makes me believe someone can still recover doesn't lie in lab results. It lies in a single spoonful of soup. It was a Tuesday morning. Patrick, 74 years old, had just gone through a minor stroke. He could no longer speak. His right hand wouldn't move. And his eyes looked blank, like a fog had swept across his memories. His wife sat beside him, gently pouring a bit of warm vegetable soup into a spoon. She brought it to his lips and softly said, "If you just sip a little, I'll know you're still here." And you know what? He did sip. As a brain doctor for seniors, I've witnessed hundreds of recovery signs. But nothing felt more real, more moving, than that silent moment. No words. Just one spoon. One small motion of the lips. One warm drop down the throat, and you know, the brain is still there. Many ask me, "Doctor, what should we do first after a minor stroke? Do we need medicine right away? Should we start physical therapy?" And I always respond gently, begin with a warm bowl of soup. It may sound simple, but it's the very first gift to a healing brain. You see, after any stroke symptoms in the elderly, the body isn't just tired, it loses the sense of thirst, appetite fades, dehydration sets in. And that's one of the silent stroke signs so many overlook. The patient doesn't complain of pain. Doesn't say they're thirsty. They just sigh. Sit still. Eyes quiet. And the family thinks, maybe they're just tired. But in truth, that is the brain crying out. And if we don't listen, we might miss the missed stroke signs, the subtle early warnings before the next stroke silently arrives. So why is a warm bowl of soup so important? The answer lies deep within the nervous system. When the brain is hurt, it doesn't need a lot, just gentle nourishment and hydration. And warm soup, not too thick, not too hot, is the simplest, most effective way to begin gentle stroke recovery without overwhelming a fragile body. If you're caring for a loved one recovering from a minor stroke, don't rush into physical therapy. Don't push them to eat rice or drink cold water. Just start with a warm bowl of soup. A soft touch of the hand. A quiet moment, but filled with connection. And next, I'll share with you a little known truth, why the body often loses water silently after a minor stroke, and how this hidden dehydration can lead to a second stroke if left unnoticed. I once asked Ms. Sharon, 71 years old, just recovered from a minor stroke, "Do you feel thirsty?" She gave a faint smile. "No, doctor, I don't feel thirsty at all." But with just a quick check. Her blood pressure had slightly dropped, lips were dry, heart rate higher than usual. Less than 2 days later, she began to show mild confusion in the afternoon, and we detected signs of microcirculation disturbance in the brain. The danger isn't in feeling tired. It's in not feeling anything while the brain is severely dehydrated. After a minor stroke, the elderly often lose the ability to sense thirst. Because the hypothalamus, which regulates heat and thirst, is temporarily disrupted. This is one of the stroke clues before attack that families rarely notice. And because there's no thirst, they don't drink. Because they don't drink, the brain lacks water. Because of the lack of water, microvessels constrict. And that silent spiral continues. Until a second stroke occurs. What worries me the most is how quiet these signs are. The patient doesn't have a fever, doesn't faint, doesn't seize. They just lose their appetite, move more slowly, speak less, and sit for a long time, unmoving. The family sighs, probably still weak after the stroke. But in truth, these are warning signs of stroke quietly showing up. I call it the brain's silent thirst. You don't see it. You don't hear it. But if you ignore it, it will knock on the door in a way you least expect. And no one wants to wake up in the ICU just because they overlooked a warm bowl of soup. During recovery, Maintaining the right amount of fluids light, warm, and easy to absorb is the foundation to prevent local oxygen shortages in the brain. No need for energy drinks, no electrolyte tablets. Just light vegetable broth, or clear chicken stock, and most importantly sipped slowly, with a spoon, bit by bit. There's something few people say: brain health for seniors doesn't begin with pills, it begins with hearing the thirst the patient can't name. I still remember another patient, who ended up in prolonged confusion for 3 months just because he didn't drink enough in the first week after a minor stroke. Simply because no one noticed his brain was withering away, little by little, not from illness, but from not being soothed with something warm enough, light enough, and understanding enough. You might be wondering, what kind of soup is best? When should it be taken? And how much is just enough, not too much for a recovering brain? We'll keep going and I'll walk you through each one, so you won't feel lost in a sea of advice. Just keep what is simple, what is gentle, what is doable. Many people still think that after a stroke, drinking plain water is enough to rehydrate the brain. But in reality, a body that's just been through trauma needs something much gentler. Why is that? Because at that moment, the brain is like a field right after a storm. The soil is still soft. The roots are still fragile. And if you pour cold water over it all at once, you'll damage the tender parts that are trying to recover. But warm soup is different. Soup is not just water. It's water with substance, with nutrients, with gentle minerals, and more importantly, the warm, moderate temperature helps the body absorb it more easily, without shocking the throat, digestive tract, or the sensitive blood vessels in the brain. Especially for seniors recovering from a stroke, drinking plain water often causes choking, or they avoid drinking because it feels too cold. But soup goes down smoothly. It hydrates. And also reactivates brain function through the simple movement of the tongue, cheeks, and throat. I often tell my patients, soup is water that knows how to love your body. And I'm not exaggerating. Because in every spoonful of soup, there's a combination of just the right warmth, the perfect light texture, the gentleness of slowly simmered vegetables, and most importantly, it doesn't scare the patient. That's what I've learned after many years as a brain doctor. Some things are simple but gentle enough to work miracles. Not expensive supplements. Not complex rehabilitation devices. But a warm bowl of soup served at the right moment. You might be thinking, so what should I cook exactly? What veggies, what meat, should I season it or not? And is there a specific time of day that's best for my loved one to drink it? I won't leave you guessing. The journey of brain recovery must go step by step. And the next step is understanding exactly how to choose the right kind of soup, the best time to serve it, and the right amount that the body can accept most easily. I still remember the first time I met Mr. Patrick, a tall man with white hair, 74 years old. The day before he was admitted, he still walked the dog every morning, still drove to the market with his wife. But the next morning, he suddenly collapsed lightly in the kitchen, slurred his words, and dropped a cup from his right hand. A minor stroke, but enough to send the whole family into panic. When I entered the hospital room, Mr. Patrick looked at me, his eyes still full of clarity. But he couldn't say a word. No tears, no cries. Just a strong man, trapped inside his own body. His wife Mrs. Jones sat by his side, never leaving him. She asked me, "Doctor, what should I do now? He won't eat, won't drink anything." I gently placed my hand on her shoulder, and simply said, "Make him a bowl of vegetable soup. Light. Warm. Feed him 1 spoon at a time." She looked at me, a bit surprised. Then nodded. I saw in her eyes a quiet sense of trust. The next morning, when I returned to the room, Mr. Patrick had taken 3 spoonfuls of soup. Not spoon-fed by someone else, but by himself, with his left hand, trembling, lifting each spoon slowly, with determination. In that moment, I saw a part of the brain awaken. A piece of memory, movement, willpower, starting to find its way back. On the third day, he spoke his first sound, Joe. Not a full word, but enough for Mrs. Joan to burst into tears. The rest of that week, he began to remember his children's names, his home address, and by the weekend he sat up, slowly reading the morning newspaper headline. That recovery didn't come from luck. It came from those repeated spoonfuls of warm soup like a ritual. I always call it gentle brain rebuilding, a kind of quiet, non-dramatic brain regeneration, fueled by small, consistent, loving actions. Mr. Patrick eventually recovered almost fully. No feeding tubes, no special supplements. Just a bowl of veggie soup every morning, a light chicken broth in the afternoon, and a patient wife, who never missed a meal beside him. I'm sharing this story with you because I know many out there are going through a minor stroke and don't know where to start. And they're missing out on the simplest things. If you're caring for a loved one, don't wait until they're hungry to offer food, don't wait until they're thirsty to bring water. Start with the very first spoon. You might be wondering, am I doing this right? Could I be accidentally doing something small that's slowing their recovery? That question is so valuable. Because many people do it wrong. Simply because no one ever told them. I'll be sharing the common mistakes in eating and drinking after a minor stroke, the things that seem harmless, but actually delay recovery day by day. I once sat for a long time beside a patient named Mrs. Ruth, 79 years old, just went through a minor stroke. Her daughter took great care of her, cooked thick minced meat porridge, gave her high-calorie milk, and kept asking, "Mom, are you full yet? Try to eat a little more, okay?" It sounded right. But Mrs. Ruth remained tired, pale, with sunken eyes, and her speech was broken. By day 4, her blood pressure suddenly dropped. And a brain scan showed mild swelling returning in the motor area of the left hemisphere. Why did that happen? Because in the process of caring, her daughter forgot one core truth: the brain needs to be nourished with water before it is nourished with food. And not just any water is suitable. Here are 3 common mistakes I see family members often make. Mistake 1. Serving thick porridge, the more the better. After a stroke, the ability to swallow is clearly weakened. Thick porridge, lots of minced meat, mashed rice. Sound nutritious, but they easily cause choking, leading the patient to fear eating and eventually skip meals. When the brain is newly injured, what matters isn't nutritional value, but rather light, thin, easy to pass through the throat, easy to digest, and doesn't put more strain on the brain. Mistake 2. Giving cold drinks or fruit juice. You might think orange juice or apple juice is good. But for someone who just had a stroke, liquids that are too cold or too sweet can cause blood vessels to constrict, and that increases the risk of a second stroke. The recovering brain is like a glass tube. A single wrong touch could create a crack. Mistake 3. Not noticing that the patient isn't drinking water. This is the most common thing I see. Family members think, if they're not thirsty, then it's fine, I won't force it. But after a stroke, the sense of thirst can temporarily vanish. And if we don't remind, don't gently offer, don't pay attention, they can quietly fall into severe dehydration without anyone realizing. That's what we call missed stroke signs, silent stroke signs, things no one teaches you but you must know if you're caring for someone recovering. The solution? It's not hard. No machines needed, no high costs. Just a bowl of thin, bland, warm soup, a small spoon, and someone patient enough to offer 1 spoon at a time. Take it slow, but stay consistent. That's the simplest way to keep the brain from further shrinking. So, what should you cook? When during the day is the best time to drink? And how much is enough to help the brain breathe easier without adding pressure? I'll share all the details from ingredients to timing so you can apply it right in your own little kitchen. No guessing, no worrying. Just clarity and simplicity to protect the most precious thing in your loved one, memory and clarity. I know. After everything we've shared, you might be wondering, so what exactly should I cook? How much is enough? And when is the best time to drink it for brain health? Don't worry, I'll walk you through every detail as if I were right there in the kitchen with you. First, what kind of soup should you cook? You don't need expensive or fancy ingredients. What I always recommend is warm soup, simple, easy to digest, no heavy seasoning. Here are 3 gentle recipes I often suggest for patients in the first week after a stroke: mild vegetable broth, pumpkin, carrot, white radish, a small piece of green onion. Simmer well with plain water, no salt added. You can strain it through a fine mesh for easier swallowing. Clear chicken broth, a small piece of skinless chicken breast. Simmer on low heat for about 1 hour, skim the foam, strain to keep it clear. No bouillon, no onion or garlic. Light miso soup, if familiar with Japanese flavors. Organic miso paste, dilute very thinly, just 1/4 teaspoon per serving. Drink it like a light mineral water, without adding seaweed. I always emphasize, no oil, no salt, no sauces, no flavor enhancers. Because at this stage, the brain doesn't need stimulation of the taste buds. It needs gentle nourishment to help microcirculation recover. Second, when is the best time to drink it? I usually recommend 2 golden windows during the day: morning, from 7:00–8:00 a.m. when the body has just awakened. The brain needs a soft start with fluids and light minerals. Soup at this time helps replenish water after a long night's sleep, and reduces the risk of lightheadedness. Afternoon, from 3:00–4:30 p.m. This is when the brain tends to tire, feel drowsy, and experience blood pressure swings. A bowl of soup at this time helps maintain brain vessel stability and prevents sudden drops in pressure. Third, how much is enough per serving? Not much. Just 150,200 milliliters each time, about 1 small bowl. Use a spoon. Drink slowly. Don't force it. Don't pour it into a cup and gulp it down. Because the brain heals best through gentleness, not urgency. If possible, sit next to your loved one while they drink. Help them sit upright. Speak softly. And offer each spoonful as if you're sending a signal of healing to their brain. 1 warm stream, 1 mindful drop at a time. You know what? Stroke prevention tips aren't always about medication or machines. Sometimes, it's simply the patience of someone sitting nearby. And a bowl of soup made with the whole heart. Soon, you'll start seeing something remarkable. The body is no longer sluggish. The skin turns rosier. The eyes brighten again. The mouth moves more fully. And your loved one begins to ask you something clearly, in their very own voice. You may not notice the change on day 1. But let me tell you this, if you keep doing it right for just a few days, the signs of recovery will quietly return. Softly, but clearly enough to move your heart. Many people ask me, "Doctor, how do I know if my loved one is truly recovering? Are there any clear signs? Or are we just hoping too much?" I always answer with a warm smile and a very specific list. Because you know what, the body never hides recovery. It just expresses it through very small, subtle yet hopeful signals. In the first 3 days, you may notice, the patient sighs less, and doesn't look tired all day. Their lips turn slightly pink, no longer dry and pale. Their eyes begin to follow loved ones moving around the room. Arms and legs may still be weak, but no longer droop completely. These changes are often missed if we only look for big signs like speaking or walking. But to me, these are the most important stroke recovery signs in the early stage. By day 5 to 7, the patient may whisper a few simple sounds when asked. They nod or shake their head accurately. They reach for the spoon, even if their hands still tremble. And sometimes, They let out a soft laugh when you tell a funny story. It's not full recovery, but it's the brain reconnecting with itself. The areas around the damage begin to share the load, building new networks to help the body gradually return. This is what I call gentle brain rebuilding, quiet recovery, not dramatic, but steady and real. After around 10 days, they can call out a loved one's name. Their face starts showing more expressions. They sleep deeper, without tossing and turning. And most importantly, they want to eat, want to drink, without constant reminders. I still remember Mr. Patrick on day 10 looked at his wife and clearly said, "Give me another bowl of soup." Just 6 words, but enough to make the entire room cry. That's why I always tell families, don't just count footsteps. Count the lip movements, the gazes, the nods too. Because every little gesture is the brain's way of saying, I'm finding my way back. And don't forget, stroke symptoms in seniors don't look like those in younger people. They may not shout, "My head hurts." They may just sit quietly, refuse to eat, or look at you without speaking. But if you stay patient, if you learn how to listen for them, you'll witness the miracle one day at a time. Then come those days. They pick up the spoon themselves. They say, "Have you eaten yet?" They smile when you joke. And you'll know, you weren't wrong to start with that small bowl of soup. But still, there are moments when your loved one suddenly refuses to eat or drink, especially warm soup, and many assume it's because they're bored or already feeling better. In reality, it could be the brain quietly signaling that something is changing and we must stay more alert than ever before. One afternoon, I was urgently called in. The patient was Mr. Henry, 78 years old, in his second week of recovery after a minor stroke. Starting from day 4, he'd been eating well, drinking, alert, and speaking clearly. But that day, he suddenly turned his face away when his wife brought in the soup. He said nothing. Didn't touch the spoon. And his wife just thought, maybe he's tired of eating. 3 hours later, he had a mild dizzy spell. The blood vessels in the right frontal region of his brain constricted. And we detected early signs of localized blood flow disturbance. Do you see? When your loved one refuses a bowl of soup, it's not always because they're full. It might be their brain sending a vague signal, something's not right. That's exactly what stroke clues before attack look like, the subtle hints that, if you notice, can stop the next step from happening. For seniors, especially after a minor stroke, these silent stroke signs never come with a loud alarm. They show up as a distant look in the eyes, a headshake without reason, a skipped bowl of soup in the late afternoon, and sadly, many family members overlook these signs, thinking it's just old age mood swings. I've met many families who say, "He just doesn't like that dish. She's probably just not hungry today. It's just soup, skipping it won't hurt." But I see it differently. I see the brain staying quiet, as a way of crying out. If your loved one refuses soup, observe more closely. Are they still speaking fluently? Do they still remember your name? Is there any change in their gaze, voice, or posture? If so, don't wait. Don't see how it goes. Take action. A call to the doctor. A quick blood pressure check, a light assessment. It could be the thing that changes the entire course of their recovery. I don't tell you these things to make you anxious, but to empower you with awareness. Because I know, stroke signs most seniors miss are exactly the ones we, the ones by their side, can notice for them. And if you can do that, you're not just a loved one. You're the one preserving a voice, a glance, a memory for someone you love. I believe when someone turns away from a bowl of soup, they're not just saying "I'm not hungry." They may be trying to express something much deeper. Please, notice me. Please, don't ignore this little thing. Please, don't let me slip away again. And if you've ever heard that even without words, please remember, you can do something. Starting this very afternoon. And if you're already on the right path, and your loved one is slowly recovering. Keep going. Because every spoonful of soup, every quiet meal, is a small step on the road back. And one day you'll see that same person will look at you and say, "Thank you for not leaving me behind when I couldn't say it out loud." If you've made it this far with me, then perhaps you understand this journey is not a race. It's a homecoming, one step, 1 second at a time. Let's close this with a quiet, heartfelt ending where a bowl of soup is not just nutrition, but a symbol of survival, of connection, and of a promise that you are never alone. I've seen the most advanced medical equipment. I've witnessed delicate brain surgeries that lasted 4 hours. I've read hundreds of stroke recovery reports. But you know what? The moment that makes me believe in life the most is when a patient raises their hand, trembling, and sips the first spoonful of soup. Because that moment is not just about eating. It's the sign that the brain can still receive. The will is still there. And that person is on their way back. As a brain doctor for seniors, I've learned something deeply important after all these years. Not every recovery begins with medication. Some begin with steady kindness. 1 spoon. 1 day. 1 person sitting nearby. A bowl of soup may seem small, but within it contains water that softens the brain, nutrients that restore blood vessels, and most importantly, care given slowly enough so the brain can keep up without rush, without pressure. If you're caring for a loved one after a minor stroke, please believe this: you're not alone. And what you are doing, even if it feels repetitive each day, is making a bigger difference than you realize. Brain health for seniors doesn't come from a single appointment. It comes from tiny habits repeated with heart: the evening bowl of soup, the waiting glance, the gentle question, "Can you eat a little more?" The soft yes but clear and certain. I hope that after hearing this, you'll look at a bowl of soup through a new lens. Not just a light, nutritious meal, but a bridge between survival and healing. A quiet ritual, carrying this message: I believe you will come back. And I will wait. If you're walking this journey with someone you love, please comment, "I'm starting with 1 spoon of soup," so I know you're also choosing recovery from the smallest things. And if this video touched you, please share it with someone who may need it. Because maybe, just one gentle invitation from you could help save someone's voice, memory, or gaze. And I truly believe this: each warm spoonful can be a small, steady step that brings your loved one back. You don't have to do anything extraordinary. You just have to not overlook the ordinary at the right time.